Thank you and welcome to my YouTube channel. And if you have subscribed, a big thank you to you. If you haven't, hopefully you'll be considering doing that today and possibly share. I'll be discussing two aspects or two very important factors that I'm going to mention that will help us understand and appreciate rheumatoid arthritis. In the course of these chronic inflammatory states, the body produces two very important factors. Number one, rheumatoid factor. Number two, anticyclic citrullinated peptide antibodies. Now, I need to spend a little time here to explain these concepts. Now, rheumatoid factor, though, could be present in patients that have rheumatoid arthritis as a result of the chronic inflammatory state. That does not mean that every time you test and the patient has rheumatoid factor, the patient has rheumatoid arthritis. Now, I need to explain this very carefully. Sometimes you have situations where a patient goes to the hospital, presents with joint pain, the test is done, result says rheumatoid factor positive, and then it is concluded that the patient has rheumatoid arthritis. That is incorrect. As much as rheumatoid factor could be present in a patient that has rheumatoid arthritis, its presence does not automatically mean that the patient has rheumatoid arthritis. Now, the reason is simple. Because it's a function of chronic inflammatory state, any chronic inflammatory condition can actually result in the production of rheumatoid factor. I'll give you an example. Patients that have tuberculosis can also present with a positive rheumatoid factor. But that doesn't mean that they have rheumatoid arthritis. A patient that has chronic hepatitis can also have a positive rheumatoid factor. That doesn't mean that they have rheumatoid arthritis. Now, am I in any way suggesting that rheumatoid factor is unimportant in the diagnosis of rheumatoid arthritis? Absolutely not. What I'm saying is that the presence of rheumatoid factor is not 100% indicative of the presence of rheumatoid arthritis. When we come to the section on making a diagnosis of rheumatoid arthritis, I'll explain this further. The other test is anticyclic citrullinated peptide antibodies. Now, recall that I said that the enzyme peptidyladenine deaminase 4 carries out a process called citrullination, which is the conversion of adenine, an amino acid, to citrulline. Now, when it does that, when this attack occurs against these cells that are now seen as foreign, the body produces autoantibodies referred to as anti-citrullinated peptide antibodies. Now, unlike rheumatoid factor, which is not specific for rheumatoid arthritis, anticyclic citrullinated peptide antibodies are specific for rheumatoid arthritis. Therefore, if I request for a test and the result shows me that this blood sample does have anticyclic citrullinated peptide antibodies, there is a strong chance, in fact, in more than 95 to 97% of cases, that patient really does have rheumatoid arthritis. Now, we can put this all in summary that rheumatoid arthritis is a chronic inflammatory disorder that is characterized by synovial inflammation. Remember, I've defined what synovial membrane is. Autoantibody production, I've mentioned rheumatoid factor and anticyclic citrullinated peptide antibodies, as well as these synovial hypertrophy producing panus, which is the synovial membrane that is thickened, resulting in the destruction of cartilage and bone, and actually any other structure along the line. Thank you very much. Hopefully, you will continue with other videos concerning rheumatoid arthritis series. Thank you.